My name is Bontile Motloung. I am a Vaccine Preventable Disease Surveillance Officer. I am based in the Eastern Cape Province, so I work closely with the province on matters around surveillance on polio, measles, neonatal tetanus, and I'm also supporting Free State Province and Mpumalanga Province also with the surveillance program and EPI. Okay, I'm a daughter, I am a sister, I am a mother. I'm an introvert, I read a lot, I love nature, I'm outgoing, animal lover, partially vegetarian. Yeah, I love people as well. So yeah, that's it about me. I have two kids, Lilita and Sisipo. Lilita is 9, Sisipo is 7. I first heard about the gentleman who was traveling with his wife. I saw it on the news. It was the evening news around 7 p.m., just sitting with the family. And I remember they said, we now have a positive case. I remember before then, it had already started to pop up in other countries. And they had already started to record about the deaths that were happening. So once it hit our shores, when I heard that, it has hit our shores, definitely it sparked some worry. On my side, it definitely did that. You know what, from what we've seen with other countries, it takes one case and within a week, within 2 weeks, already you have about hundreds of cases. And just knowing our health system in South Africa, for myself, I already knew that, yeah, we need to buckle up. It's definitely going to hit us hard as well. I think once the lockdown was implemented in the country, and then people were told to stay away. But then it's like, I knew that that's not for me. I have to be out there, and I do have kids, small kids. And I also stay with an elderly lady who helps out in the house. So, and I had to be there in meetings. And we didn't know a lot about the coronavirus. And I have elderly parents. I worried a lot about them. Are they social distancing? Are they staying at home? Are they wearing masks? With parents, they may not take it as seriously as it is at the time. So I had a lot of those worries, and I couldn't go home. It was locked down. I couldn't go home to even see my dad. You call them, there's a little cough, you worry, you're not sleeping. So there was a lot. It wasn't easy at all. It definitely wasn't easy. And being out there, as much as I wanted to be out there, I wanted to do my work. I wanted to help out whatever it necessarily that I needed to do. But at the same time, personally, in my life, it was a struggle. Like the guilt, the worry, the sleepless nights, and children don't understand. I remember I got symptoms. Probably around May or April, May or June 2020. I got tested, but then I had to quarantine. And it was not easy because I had to quarantine at home. At the time, they hadn't established those quarantine sites because it was still pretty early. And it was so hard to even social distance from home. But fortunately, I tested negative. But that time was very difficult, It was a difficult time, yeah. In August of 2020, I lost a cousin, and it was a painful experience because she was doing her matric, her last year in high school. She was a passionate student. She wanted to do well. She wanted to take her family out of poverty. So she wanted to go to school. But then she did have type 1 diabetes. She had had it most of her life. But when they told me, that they started to loosen the restrictions a little bit, and then because they're matrics, there's a lot of pressure in South Africa as a matriculant to do well at the end of the year. There are all these extra classes, there are all these extra lessons already. The lockdown was already impacting on that. And knowing her, because I lived with her for about 2 years before I moved to the Eastern Cape. So knowing her, I knew that even with her type 1 comorbidity, she was definitely going to go to school. And she did. She was there for 1 week. The following week, she got sick. She was admitted. She was sick for 2 days, and then she died. And it was a very hard time. Yeah, it was a very hard time. Fortunately, I was able to travel to the funeral, but it was a hard time. I know, I've seen what COVID is doing, and in the Eastern Cape, what actually drove the pandemic in the Eastern Cape was a funeral. Like, so most of the cases that we have are stemming from one funeral, you know. So I also had that trauma with me of like, I know the kind of situation that can come from a funeral. But at the same time, I hadn't seen my family in such a long time. It's been locked down. I hadn't seen my parents. I want to take advantage of that, but at the same time, it's like you want to be like, hey, we had a COVID funeral. It's COVID. Why aren't you wearing masks? You know, at the same. But people are sad. People are devastated. So it was a difficult and not so nice experience. I mean, of course, it's a funeral, but at the same time, it worried me a lot because I really thought it would be another incident that will create more cases, and there were a lot of elderly people at the funeral.